Today we will give some important information to our viewers related to babies' health.
What kind of information, Nimra?
There is a dangerous disease which exists in infant babies that is called ShakenBabySyndrome.
I have never heard about this.
ShakenBabySyndrome is a serious brain injury caused by forcefully and violently shaking a baby. Other names for this condition include abusive head trauma, shaken impact syndrome, and whiplash shake syndrome. ShakenBabySyndrome is a form of child abuse that causes severe brain damage. Babies have soft brains and weak neck muscles. They also have delicate blood vessels. Shaking a baby or young child can cause their brain to repeatedly hit the inside of the skull. This impact can trigger bruising in the brain, bleeding in the brain, and brain swelling. Other injuries may include broken bones as well as damage to the baby's eyes, spine, and neck. Playful interaction with an infant, such as bouncing the baby on the lap or tossing the baby up in the air, won't cause the injuries associated with ShakenBabySyndrome. Instead, these injuries often happen when someone shakes the baby out of frustration or anger. You should never shake a baby under any circumstances. Shaking a baby is a serious and deliberate form of abuse. This is a life-threatening condition that requires immediate medical treatment.
What are the symptoms of ShakenBabySyndrome?
ShakenBabySyndrome occurs when someone violently shakes an infant or toddler. People may shake an infant out of frustration or anger, often because the child won't stop crying. Although shaking does eventually make the baby stop crying, it's usually because the shaking has damaged their brain.
Oh. How is ShakenBabySyndrome diagnosed?
To make a diagnosis, the doctor will look for the three conditions that often indicate ShakenBabySyndrome. These are MRI scan, which uses powerful magnets and radio waves to produce detailed images of the brain. CT scan, which creates clear, cross-sectional images of the brain. Skeletal X-ray, which reveals spine, rib, and skull fracture. Ophthalmic exam, which checks for eye injuries and bleeding in the eyes.
How is ShakenBabySyndrome treated?
The American Red Cross recommends the following steps to perform CPR. Carefully put the baby on their back. If you suspect a spinal injury, it's best if two people gently move the baby so the head and neck don't twist. Set up your position. If your infant is under age 1, put 2 fingers on the middle of the breastbone. If your child is over age 1, place one hand on the middle of the breastbone. Put your other hand on the baby's forehead to keep the head tilted back. For a suspected spinal injury, pull the jaw forward instead of tilting the head, and don't let the mouth close. Perform chest compressions. Press down on the breastbone and push about halfway into the chest. Give 30 chest compressions without pausing while counting out loud. The compressions should be firm and fast. Give rescue breaths. Check for breathing after the compressions. If there is no sign of breathing, tightly cover the baby's mouth and nose with your mouth. Make sure the airway is open and give 2 breaths. Each breath should last about 1 second to make the chest rise. Continue CPR. Continue the cycle of 30 compressions and 2 rescue breaths until help arrives. Be sure to keep checking for breathing. In some cases, the baby may vomit after being shaken. To prevent choking, gently roll the baby onto their side. Make sure to roll their entire body at the same time. If there is a spinal cord injury, this method of rolling reduces the risk of further damage to the spine. It's important that you don't pick up the baby or give the baby food or water. There is no medication to treat ShakenBabySyndrome. In severe cases, surgery may be required to treat bleeding in the brain. This may involve placement of a shunt, or thin tube, to relieve pressure or to drain excess blood and fluid. Eye surgery may also be needed to remove any blood before it permanently affects vision.
Oh, poor kids. What are our outlook for children with ShakenBabySyndrome?
Irreversible brain damage from ShakenBabySyndrome can occur in a matter of seconds. Many babies experience complications, including permanent vision loss, partial or total hearing loss, seizure disorders, developmental intellectual disability, cerebral palsy, a disorder that affects muscle coordination and speech.
How can shaken baby syndrome be prevented?
Shaken baby syndrome is preventable. You can avoid harming your baby by not shaking them under any circumstances. It's easy to become frustrated when you can't get your baby to stop crying. However, crying is a normal behavior in infants, and shaking is never the right response. It's important to find ways to relieve your stress when your child cries for extended periods of time. Calling a family member or a friend for support can help when you feel yourself losing control. There are also some hospital-based programs that can teach you how to respond when infants cry and how to manage the stress of parenting. These programs can also help you identify and prevent the injuries associated with shaken baby syndrome. Make sure your family members and caregivers are also aware of the dangers of shaken baby syndrome. If you suspect that a child is the victim of child abuse, do not ignore the problem. Call the local police or the Child Help National Child Abuse.
So my dear friends, if you have gained sufficient knowledge and understanding about baby shaking syndrome, then make sure that you and your other family members should not ignore these facts that has been shared in the video. For more interesting and important informative videos, subscribe our YouTube channel and also click the bell icon to get notifications for our new video.